Hi, everyone. I'm Dr. Seth Meyers, clinical psychologist, and I'm going to talk just briefly today about what is the best type of treatment for avoidant personality disorder. For avoidant personalities who are dealing with just wanting to avoid uncomfortable emotions, situations that trigger anxiety, relationships that can feel really scary, there is hope and there is help. Now, I think that the most effective treatment for avoidant personality disorder is cognitive behavior therapy. Cognitive behavior therapy is very specific in that it targets thoughts and behaviors in a way that's especially helpful. So I'll just share a few examples of what that looks like. CBT can help you identify, if you have avoidant personality yourself, the negative beliefs and thoughts that you have that get triggered in certain situations. Once a CBT therapist helps you identify some of those thoughts, you can get better at identifying them and then engaging in self talk, contrary action, the opposite thinking to try to help you manage that situation. A CBT therapist can also do exposure therapy with you. Now, not every therapist is trained in exposure therapy, so you really want to make sure from the start that you have asked a therapist, do you specialize in working with CBT? And also, what is your experience in doing exposure therapy? So, with exposure therapy, your CBT therapist can help you gradually expose yourself to situations that step by step normally would create a little bit more anxiety, would trigger that fear of rejection, would trigger that anxiety, would trigger some of those negative beliefs and help you stop those in their tracks because you would be in a safe, comfortable environment. And with the guide of a good CBT therapist, you can find those moments aren't as stressful as you had always thought. CBT can also help provide you with better social skills, specific communication skills that can help you manage your natural avoidance. CBT can help you with very specific behaviors like making eye contact in the beginning, sustaining eye contact in a comfortable way, initiating conversations, starting conversations in a way that feels comfortable and natural so that it doesn't feel like the stakes are so high in that moment. It's just something that you practice. And remember, I always say that whatever you practice gets stronger. So the more you practice with a CBT therapist, some of these specific behaviors, the stronger that will get. And the more natural and automatic some of these healthier coping behaviors can be. So CBT is something that can be really helpful if you have avoidant personality disorder. If you find this video helpful, please like it so that I know what you find helpful. And you can always check out my podcast, Insight with Dr. Seth. Weekly, we talk about mental health topics that matter most to you.